So now I'd like to move into talking about the work that we're doing, again, in only 3 communities. And in this particular area, Bosnia and Herzegovina, we started our work in 2008 with an amazing woman by the name of Nella, and I don't see her here today, who has been truly an amazing champion. We did this program, again, in partnership with the JDC and the WHAEP, the Women's Health Empowerment Project. When this race came together, there were 2,500 people, Croatians, Serbs, and Russians. And I want you to really think about this. Looks like a moment of incredible celebration with people from all the way around the country. But think about how this was built in the middle of a war-torn country. That the spirit, and drive to create a program for breast cancer was so strong that even in the middle of all this destruction, they wanted to move this program forward. I think that that's the power of advocacy, the power of potential. Moving past what is a grave reality to truly create something impactful and powerful. So the Women Health Empowerment Project has many tenets, and again, I don't have time to cover all of these in total, but one of the assessments that they understood they needed was a call-in helpline, an SOS line. So as they moved forward, again with their assessment, they said, how can we begin to develop this? It's a war-torn country, so people can't always meet in support groups. They can't always get to one another. So they started a helpline. Within 5 months, they had 400 calls. After the race, which of course was a wonderful vehicle to tell people it's okay to call the helpline. And then at the race, a media company got excited. So they did a broadcast. Now hundreds and hundreds of people use this resource. And I want to underscore that this helpline is staffed by volunteers. And they're a diverse group of women from different socioeconomic, religious, and backgrounds. And they're all come together with one truth. Their survivors in their breast cancer does not discriminate against any of those things. The other really remarkable thing about this program is how they've managed to engage grass tops. So again, go back to that terrible image of this war-torn country. You would know that in an area like this, in order to really make progress, they have to have grass tops. So the prime minister of the country is involved and came to the very first conference and pledged publicly his support for the program. Health ministers in Sarajevo and Banja Luka, and then other very important people who were visible and gave very visible support came forward. So again, that's not the program in entirety, but a snapshot of a couple of activities. Now we're going to move to Egypt, and Dr. Mohammed Shalan is here with us. There he is. And he came to us and said that he really thought that a program in this amazing country would be so impactful and so powerful. So in collaboration with the Breast Cancer Foundation of Egypt, we lit one of the 7 wonders of the world pink and I wonder if our partners from GE are here today because, of course, they made that part possible. When we first started talking with Dr. Shalan about this, creating an awareness and education event in this country where breast cancer is taboo, where people don't talk about their diagnosis outside of their homes and maybe not even inside their homes, people told us that we would be lucky to have 300 to 500 people come. Guess what? 7,000 people came to walk around the pyramids from all over the region. It was so incredible and so impactful. But one of the reasons that this program was so incredibly powerful is that starting with Dr. Shalan and the Breast Cancer Foundation of Egypt, we worked in an integrated approach with grass tops and grassroots organizations to make this work possible. Susan G. Komen for the Cure alone, Dr. Shalan on his own could not have gotten 7,000 people there that day. The ministers of health were involved. The embassies were involved. Hopkins, there was also a medical education component of this week. IIE, so again, Course for the Cure, teaching about advocacy, education, and awareness. USAID, and then certainly very important, the Suzanne Mubarak Regional Center for Women's Health and Development. all of these forces came together. So this just happened last October, and when we saw Dr. Shalon in March at our advocacy conference in Dallas, he told us that already, because of those awareness activities, because of that breaking down the wall of taboo, women who noticed changes in their breast were already presenting with earlier stage disease. We know that that's the very first step in creating downstage in a country. Now, there's a long way to go, and we look forward to hearing about the tremendous efforts and the continued work in that region, but that's a very first step in education and awareness. And certainly there's much more work, and I would want you to encourage you to talk to Dr. Shalon about his plans, but again, in the interest of time, we'll kind of move to the last area in Latin America. At this point, we're thrilled and delighted with our partnership with Course for the Cure in Latin America, where we're supporting 23 community projects designed to address some of the most pressing issues in Brazil, Mexico, and Costa Rica. And I'd like to highlight the work of Dr. Myra Kalefi, who's in the back, who's been a partner with us for more than 15 years in Brazil. She truly is, in many ways, the First Lady of Brazil in terms of bringing forward the health and wellness of the women of her country. A passionate, ardent advocate, a skilled and dedicated surgeon. We're proud, to have her as our friend. So these projects span and invest a number of different areas: education and awareness, advocacy issues, early detection, and in specific, some of the things that we've done. In Sao Paulo, for instance, we went into one of the very poorest shanty towns with the permission, again, of community leaders. So we couldn't just, as on our own, Susan G. Komen for the Cure with our little pink ribbon, say, oh, this would be a good place to go. We, again, working with Course for the Cure, said, how would we approach this very delicate situation? What's culturally appropriate and what makes sense? So we, on behalf of the invitation of community leaders, we were invited into the community where we did an assessment and talked with women about what would be meaningful and important to them. And as a result, breast health education and programs were developed. Women are now beginning to get mainstreamed into screening programs starting at age 40. And again, Dr. Kalefi has led a huge movement in her entire country around screening. We also moved to create awareness activities, and as you can see, this is actually in Mexico with an indigenous group in Oaxaca, Mexico. No one had ever been to their community to talk about breast health and breast education. And this particular program was for women and men. Incredibly powerful, and again, done with culturally sensitive and culturally specific information. And as we move into Costa Rica, I think this was a really wonderful culmination of activities in the advocacy community. So again, thinking about what are the people like, what would be meaningful to them. They developed a theater play and presented on breast health and breast cancer to migrant and Nicaraguan populations who work in a coffee plantation. So that, as you can see, as we've moved through all of these parts of the world, it's going to the people where they are, delivering the information that's important and relative to them all across the continuum, calling for action. And as we do that, we will then move into downstaging disease and truly creating this global difference that at the end of the day we're all hoping for and we know is possible. So again, thank you for your time. That's just a quick snapshot. We'll be here for the rest of the day, and we're happy to talk about our work in other regions of the world. Thank you.